Hi dear students, welcome to ardentmds. So this is just before exam. So the topic what we are going to see about supportive drugs and airway management for your COVID-19 patient. We see about DGHS guidelines, Directorate General of Health Services. So they classified the COVID-19 patient into four categories: asymptomatic, mild, moderate, severe. In case of a mild, the oxygen saturation is maintaining more than 94, the respiratory rate is less than 24. In case of a moderate, the oxygen saturation is between 90 to 93. The respiratory rate is 24 to 30. But in case of severe, the respiratory rate is more than 30. Oxygen saturation will come below 90. So based on this, the treatment and drugs which are given for the COVID patient will vary. First of all, we see about what are the drugs which are indicated for mild. In case of an asymptomatic patient, no drug is needed. But in case of a mild, you can go for antipyretic. So the best antipyretic which you can give is paracetamol, right? And you can also go for anti-tissues. So that is to decrease the cough, number one. Number two, and number three, you can go for budesonide, only indicated. Budesonide, but which type of budesonide? Oral or inhalational? Inhalational. So this is very important here. Inhalational budesonide is indicated for a mild cases. Coming to the moderate, when the oxygen saturation just falls below 94, then these patients which needs oxygen support, supports to maintaining the oxygen saturation at least by 92, right? The next drug, very important drug, is steroids, and the third is about prophylactic anticoagulant. Right. Coming to the third category, when the oxygen saturation is less than 90 and the respiratory rate is more than 30, again these type of patients, all the patient which needs oxygen support, here only the support is given for only the maintaining the saturation at 92. But in case of severe, all the patients needs oxygen supports, steroids are given, prophylactic anticoagulants are given. Right, coming to the steroids. So one of the very important drug for the COVID-19 patient, which decrease the mortality for the COVID-19. Till now, there is no other drug which match the steroids to decrease the mortality. But steroids are indicated only for the moderate and severe cases. But in some mild cases, only inhalational form is indicated. But very important, steroids are contraindicated in the early part of the disease. Why it is contraindicated in the early part of the disease? In the early part of the disease, our own body, our own immunity which acts against the COVID microorganisms. So in case if we give steroids, it acts as an immunosuppressant, so that our immunity will just come down, so that COVID-19 will proliferate more, which is very harmful to us. So that's why steroids are indicated only for the moderate and severe cases. What are the type of steroids given for the COVID-19? So number one, 6 milligram dexamethasone once per day, which is the indicated drug. In case if it is not available, then you can go for 32 milligram methylprednisolone once per day, or 40 milligram of prednisolone once per day, or the last one is about 50 milligram of hydrocortisone thrice per day. So here you have to know anything about steroids, anything they may ask you in exam. So just go back to the steroids and read all the important points which is given in the steroids. Next, what are the adverse effects of steroids? Steroid is which act as an immunosuppressant agent, so which decrease the immunity. So because they decrease the immunity, opportunistic infection which increases. So one of the opportunistic infection very common nowadays is about mucormycosis, you know very well, and they may ask you some questions from mucormycosis also. So we have a separate session for this. What is the drug of choice for mucormycosis? The drug of choice for mucormycosis is liposomal amphotericin B. So right, so in case if it is liposomal amphotericin B is not available, then you can go for a crystallized amphotericin B. Next, what is the adverse effect of this amphotericin? Adverse effect of amphotericin is nephrotoxicity. That is very important. So because it produces nephrotoxicity, you have to go for the renal function test for the patient who are giving amphotericin B. Right. The next is about steroids, which gives hyperglycemia. So, in case of diabetic patient, it is very dangerous. So, for a diabetic patient, you have to go for a controlled steroid given. Mean you have to check the blood glucose level frequently for the patient who give steroids. Right. Coming to the next very important drug, which is called as Remdesivir. So Remdesivir is indicated as per India guidelines, but it is not indicated by WHO. According to the Indian guidelines, it is indicated only for moderate and severe cases, and only those patients which are on oxygen therapy and within 10 days of the onset, and only for the hospitalized cases. So Remdesivir is indicated, and how this Remdesivir is act, and what is the route of administration. The route of administration is intravenous. The mechanism of action is it inhibits RNA dependent RNA polymerase. Because it inhibits RNA dependent RNA polymerase, microorganism doesn't multiply. So this is the mechanism of action. Coming to the adverse effect, it may produce anaphylaxis because it is given by intravenous form. It produces infusion related reaction, and as like other drugs, it also produces nausea. Precautions to be taken when you give the Remdesivir are monitoring of the kidney function test, liver function test, and prothrombin time. And in case if the patient is having glomerular filtration rate is less than 30 ml per minute, or alanine transaminase more than 5 times the normal, then you should avoid Remdesivir. And one more important thing is, shall we give Remdesivir along with chloroquine? Chloroquine is a drug initially approved for the COVID-19, but it is not approved. But anyway, Remdesivir should not be combined with chloroquine which decrease the antiviral activity of the Remdesivir. Come to the next drug, which is called Tocilizumab. Tocilizumab, otherwise called as Atezolizumab. So this is one of the monoclonal antibody which against interleukin 6 receptor, one of the very important interleukin released in cytokine storm. So it acts as an immunosuppressant. Previously, it was used for rheumatoid arthritis, psoriatic arthritis, but now it is indicated for COVID-19. So this is what called as emergency use authorization, EUA. What is EUA? EUA is emergency use authorization. So during public health emergency, so it gives permission to the use of unapproved drugs for diagnosing treatment. This is what called as emergency use authorization. So Tocilizumab will come under EUA. So because it was previously used for rheumatoid arthritis, now it is also indicated for COVID-19, but it is not FDA approved. And what is the dose which is given for the Tocilizumab? 8 mg per kilogram, and maximum 800 mg can be given. And the route of administration is intravenous. What are the indications? Tocilizumab, which indicated only for the cytokine storm. So after day 6, if the interleukin levels are elevated, then you can start to give Tocilizumab. And in case of only severe or critically ill patients, when the C-reactive protein is more than 75 mg, and if there is no improvement in the oxygen requirement after 24 to 48 hours, even with steroids, then it is indicated. Tocilizumab is contraindicated in immunosuppressive patients, infections, and in case if the patient is having risk of GI perforations, when the neutrophil count is less than 50 and platelet count is less than 50,000, and if the alanine transaminase is more than 5 times than the normal, then Tocilizumab is contraindicated. Coming to the next monoclonal antibodies, bamlanivimab. So this drug generally end with Vimab. So bamlanivimab along with the combination of etesevimab indicated for COVID-19 patient. Similarly, casirivimab, which is along with imdivimab indicated for a COVID-19 patients. Just know the drugs name, and especially these drugs are indicated only for the non-hospitalized patient. Remdesivir, what we studied, which is indicated only for the hospitalized patient. But this monoclonal antibodies, this is indicated for the outpatient treatment. So again, it is a drug which will come under emergency use authorization. So next is about Baricitinib. Baricitinib, which is indicated for the COVID-19 through oral. And again, this is this drug which is come under EUA. That means it was previously used for some other purpose. Now it is used for COVID-19. So previously it was used for rheumatoid arthritis. What is the mechanism of action of Baricitinib? Baricitinib given along with the Remdesivir, it inhibits the JAK pathway which reduces the release of interleukins. So what is the precautions? So it may causes thromboembolism. So you have to be give carefully for the Baricitinib. Coming to the prophylactic anticoagulants like unfractioned heparin, low molecular weight heparin and fondaparinux. So how this prophylactic anticoagulant act? This anticoagulant which activates antithrombin 3. So this antithrombin 3 which inactivate factor 10A and factor 2A. So coming to the unfractioned heparin, so this is which inhibiting factor 2A and factor 10A with low molecular weight heparin and fondaparinux which inhibit only factor 10A. So low molecular weight which also inhibits factor 2A, but it is not consistently. So how to remember these extra points related to the prophylactic anticoagulants. And coming to the 2-deoxy-D-glucose, which is a recently used indicated drugs for COVID-19, but there was no particular clinical trial for 2-deoxy-D-glucose. So just remember what is this 2-deoxy-D-glucose. As the name says, so it is D-glucose. So but deoxy. So usually in a glucose molecule, it is some hydroxy molecules will be present. So this hydroxyl molecule is removed and it is replaced by the hydrogen. It becomes 2-deoxy-D-glucose, and usually this inhibits hexokinase because it inhibits the hexokinase, one of the very important enzyme in glycolysis. So because the glycolysis does not occur, this microorganism does not able to survive. So this is the mechanism of 2-deoxy-D-glucose. What are the drugs which was considered previously but it is not indicated nowadays? Chloroquine, hydroxychloroquine, ivermectin, azithromycin, colchicine. So these are the drugs which are not recommended nowadays according to the guidelines. So coming to the airway management, every hospital should have ARD, that is airway responsive team. So they have two airway responsive team. One is about non-urgent ART notification, and what is the criteria for urgent ART notification? So the criteria for non-urgent airway responsive team notification is number 1, in case of the patient who is confirmed or suspected infection with COVID-19 and dyspnea or wheezing. So this is number 1. Or if the patient is having comorbidities like asthma, chronic obstructive pulmonary disease, heart failure, renal disease, stroke or immunosuppressed. Criteria for the urgent airway responsive team notification is in case of confirmed or suspected infection with COVID-19 and one of the signs among this, tachypnea, mean more than 30 breaths per minute, hypoxemia, and increased work of breathing, stridor, radiographic evidence of worsening disease on the chest imaging. So these are indicated for the urgent ART notification. So in case of a step 1, so for the normal ward, either you can go for the nasal cannula or non-rebreather masking. Once the patient goes for the next stage, that is step 3, then you can go for continuous positive airway pressure, that is CPAP, which is indicated. So here the oxygen from the machine which directly transferred to the lungs. In the last area, you can go for something called as extracorporeal membrane oxygenation, where the patient is fully sedated, blood is pumped in and out of the body. So these are the various types of airway management we have to know. Coming to the important golden points related to this drugs which are used for the COVID-19. Coming to the drug of choice for mucormycosis. So what we studied? Liposomal amphotericin B. Right. Tocilizumab is an effective against which type of interleukin? Tocilizumab, which is indicated for interleukin 6. How does 2-deoxy-D-glucose change from the structure of glucose? So in case of a glucose, 2-hydroxyl group is removed and replaced with hydrogen. Replaced with hydrogen. Mechanism of remdesivir is it inhibits RNA dependent RNA polymerase so that microorganism proliferation will be inhibited. The mechanism of baricitinib, it inhibits JAK pathway so that it inhibits the release of interleukins. Fondaparinux, which inhibits which clotting factor? Factor 10A. Remdesivir can be given combined with the chloroquine. Is this true or false? It is a false statement because when you give remdesivir along with the chloroquine which decreases the antiviral activity of remdesivir. Baricitinib, which is given combined with remdesivir, yes, it is true. What is the important adverse effect of amphotericin B? It causes nephrotoxicity. So frequent renal function test is indicated for the patient who take amphotericin B. What is the respiratory rate in case of severe COVID-19? In case of a severe COVID-19, the respiratory rate is more than 30. So coming to the very important Ardent flash. So all the things what we discussed till now, which is given in a single slide, just take a pass and go through all the important points. So here I explained about steroids, remdesivir, 2-deoxy-D-glucose, bamlanivimab, baricitinib and anticoagulants, also about tocilizumab. So all the important points which covered here, and come back to the questions. The drug hydroxychloroquine is contraindicated in all the following except hydroxychloroquine is contraindicated in retinopathy, hypersensitivity, G6PD deficiency. So answer is none of the above. So what is the suggested dosage of prophylaxis with hydroxychloroquine? Hydroxychloroquine is not at all used nowadays for a prophylaxis, but in case if the examiner asked based on the previous recommendation, then you can go for the third option. 400 milligram on the first day and 400 milligram once a week for the next 3 weeks. Treatment of COVID-19 includes all the following except. So fluid therapy you have to be given, oxygen support, prone positioning. So because they ask about except, we can go for the none of the above. In case if the patient is oxygen saturation below 95, then you can go for non-rebreathing mask. What is the mechanism of action of the drug remdesivir? So it just acts on RNA dependent RNA polymerase which inhibits the genome replication. Name the enzyme on which the drug remdesivir acts in COVID-19 patient. Yes, easy question. RNA polymerase. Remdesivir drug which also used for this is apart from COVID-19. Maybe they ask you Ebola is the drug. What is the dose of remdesivir given in COVID-19? 200 milligram initial dose followed by 100 milligram for the 5 to 10 days is the dose given for the COVID-19 patient. Which of the following are contraindication in the use of remdesivir in COVID-19 patient? So when the creatinine clearance is less than 50 and in case of pregnancy, remdesivir is contraindicated. So answer is both of the above. What is the mechanism of Tocilizumab? So which is most importantly used in the management of cytokine storm in COVID-19 patient. So it acts as anti-CD5. What monoclonal antibody levels are done before using Tocilizumab? Yes, answer is interleukin 6. So these are the various important points and concepts which you have to know related to the supportive drugs used for the COVID-19 patients. Hope it was very useful. Thank you for watching.